Attention chiropractors, slayers of subluxation, unleashers of the imprisoned impulse. I am Dr. Anthony Pellegrino from ChiroEdge, and welcome to this week's episode of the Chiropractic Research Breakdown, where each week we break down the most relevant chiropractic science and philosophy to empower you with the ammo and certainty necessary to change your community from the inside out. Today, we will be reviewing an article about upper cervical care and fibromyalgia from the Journal of Rheumatology, published in 2015. And the article is called The Addition of Upper Cervical Manipulative Therapy in the Treatment of Patients with Fibromyalgia, a Randomized Control Trial. So no, we don't say subluxation. No, we don't say adjustment. But at least it's ran an RCT and not just another case study. So you guys can get patient education information like this to your inbox. Change the healthier community by going to ChiroEdgeMedia.com. The objective of this study was to investigate the immediate and long-term effects of a one-year multimodal program with the addition of upper cervical manipulative therapy on fibromyalgia management outcomes in addition to three-dimensional postural measures. Background info you need to need is they say right from the introduction that increasing evidence suggests that spinal dysfunction, particularly in the upper cervical region, which has more mechanoreceptors per unit surface area than any other region of the spinal column, might affect central neural processing, potentially lead to maladaptive central plastic changes. The cool thing about this is oftentimes when we think about something like fibromyalgia, when we think about things like aches and pains, many in our profession choose to simply educate on discs, muscles, ligaments. What we are looking at here is central processing, is the nervous system component of that change. Evidence is emerging that spinal manipulation might ameliorate the potential issues that arise with spinal dysfunction via a positive neuromodulatory effect and thus contribute to more than simple pain management. I agree. It's not about just simply managing the pain. It's not just simply about feeling better. What it is about is actually resetting the nervous system's ability to perceive messages from the body and therefore from the environment. There's also evidence suggesting that cervical manipulation might help to modulate disordered sensory motor integration and thus counteract changes in the processing of information in the brain and spinal cord. This is such a double-edged sword for me because what they say is, and here we go, inappropriate afferentation of the vestibular nuclei is yet another plausible explanation for postural abnormalities. Therefore, upper cervical manipulation might be required to achieve optimal full spine postural correction because the rest of the spine orients itself in a top-down fashion. So they are describing the D's of the disafferentation model of subluxation, which is a brain and body model of subluxation. Okay? Improper information, improper mechanoreceptive information from the spine reaches the brain and causes an improper response. I believe that that model is going to be a major part of the future of chiropractic, and because it completely explains the neuroemotional, completely explains the changes in the HPA axis. And I love that they're using this model and simply just saying, hey, we make the muscles and ligaments feel better. However, they're still just saying spinal dysfunction instead of subluxation. They're still saying spinal manipulation instead of adjustment. And politically, this is a mess because any profession can do these things. You can have PTs who go in and rack and crack infants with zero training on that who are doing spinal manipulation. And now we as chiropractors who have our research that says spinal manipulation are in trouble now, or we are going to be looked at poorly because we're using the same words that they are because we're trying to just be accepted. This is not the approach to take. All right. So the authors are recognizing the plethora of mechanoreceptors in the upper cervical spine and how any misalignment, or what they're saying spinal dysfunction, or the first D, dyskinesia, improper movement of that upper cervical area will cause issues with more than just pain receptors. They're saying that this dyskinesia, this improper motion of especially upper cervical spine, is going to cause improper information being transmitted from the spine to the brain, which is called the second D, which is disafferentation. That information, because of how it influences the vestibular nuclei, is going to cause improper postural response, which is the third D, which is dyskinesis. The only thing that we didn't recognize here is dysautonomia. All right. So what they did in this study was they took 120 people. They randomly assigned them to a group of, our control group was education, cognitive behavioral therapy, or CBT, not CBP, CBT. Got to be important. Got to make sure we say that clearly. So it's the control group was education, cognitive behavioral therapy, and exercise. And the experimental group was all of that plus upper cervical manipulation. All 120 people had a limit of range of motion at C1, C2 based on a flexion rotation test. That's what they're doing to actually assess for the presence of spinal dysfunction. So at least they're doing a test, although it's just range of motion. What they found was that in the short term, in 12 weeks, both groups saw a significant improvement compared to baseline in fibro symptoms, in Beck depression inventory scores and in Beck anxiety inventory scores, but not compared to each other. This is going to be really interesting for you guys. So both groups, which is the exercise, the education, and the cognitive behavioral therapy, and all of that plus correcting spinal dysfunction at C1, all of those saw positive change. But when you compared them to one another, there was no statistical significance. So the fact, what they're saying is that within the first 12 weeks, there's no difference in whether or not we add chiropractic. So we can frown there. But we need to raid the rest of the article. And this, for somebody who does believe in wellness care and believe in long-term care, and not just letting people show up when they hurt, right? But actually believes in making lifestyle changes, and just simply the lifestyle change of including chiropractic, the same way that we would want to eat broccoli, not just until we felt better, but because it's the right thing to do. This is what's going to be important. Interestingly enough, what they found was that at 1 year follow-up after those 12 weeks of care, the control group of just the education, exercise, and cognitive behavioral therapy had regression back to their baseline numbers. Basically, the improvements that they saw in anxiety and depression, and as well as their fibromyalgia symptoms, went back to normal. But in the group that did all that plus chiropractic care, it remained elevated, and they actually maintained the results at 1 year follow-up. That's absolutely fascinating. Now, the authors go ahead and speculate that this is because of the global postural change that happened by simply adjusting the atlas. Because what they talk about with disefferentation is that they are literally like resetting the nervous system and allowing the body, the vestibular nuclei, to properly orient the spine. So that we know, thanks to the wonderful, wonderful research from the CBP community, Dr. Deed and company, we know that how important posture is to quality of life, to emotion, to pain levels, to so many different issues. Whether or not chiropractic is present, just simply looking at posture, we know what abnormal posture will do to the body. They're saying that because the atlas adjustment actually improved the posture, and because it improved posture, that's the reason that they maintain these results, because that posture was going to stay for longer and allow them to continue doing better. And I completely agree with that. However, diving deeper, what I believe is that the reason the posture improved in the first place was because of restoration of proper afferent information to the brain. So it's possible the plastic changes were actually made in the nervous system. So it's not just improvement in posture, but literally that over those few weeks of care, the brain literally started to perceive the body differently. Not just posturally, but it started to receive proper information from the body and actually be able to coordinate appropriate responses. It was able to actually understand what pain is and what pain isn't, and change the central processing. And I believe that that's essentially what we were doing, was helping people rewire their nervous system. Their brain began processing, handling, and adapting to positive and negative stress differently in only those 12 weeks. I mean, that's huge. That's kind of what our research on heart rate variability, that's what a lot of our research says, is that we're literally changing. Chiropractic is helping to improve the body adapt to and handle positive and negative stresses. Because we see in our practices each and every day the power of chiropractic, not only on pain level, but on physical, chemical, and emotional health. Imagine the implications here. Imagine the implications of allowing that innate to flow from above down, inside out. Now, this research is beautiful, and it's really just the tip of the iceberg on the healing potential of chiropractic care. So it's very important to educate people on the effects of chiropractic care, not only in the short term, but how their nervous system is literally changing, and how their brain will perceive their body is literally changing and being rewired for the long term. A doctor in one of the groups that I'm part of, AMPed, Dr. Dan McClyman, was going over from Beacon of Life Chiropractic in Royersford, Pennsylvania, great practice, was going over kind of some of the wellness education he does in his office in terms of long-term care. And he described this as basically a bucket, and that we're always going to, we can't put ourselves in a bubble. So our body is constantly going to be having, the flow of physical, chemical, emotional stress going in to this bucket. And I'm sure other people have used this analogy as well. He just drew it, and it was pretty cool. And that chiropractic care helps increase the size of this bucket so that we can't stop this flow of positive and negative stress from being dumped in. But what we can do is allow our body to have more of a reservoir to actually be able to handle more and more and more of that stress without allowing it to overflow. This is just simply research that supports that in individuals with fibromyalgia. So I hope that you guys got some information. Obviously, we gave this handout out last week. It was pretty awesome in the office. So go ahead, jump on ChiroEdgeMedia.com, sign up for 2 weeks, put in your credit card info. There's a 2-week trial to get this information, and it's unbranded content. But if you throw in your credit card info, we'll give you 2 weeks free. That includes your office logo and information, so you can hand it out and not worry about having my branding on it, which is awesome. And you could always, cancel after 2 weeks, but I hope you don't, because I look forward to helping you continue to change your practice from the inside out. All right. Thank you, guys. Go slay some subluxations this week. I'm Dr. Anthony Pellegrino from ChiroEdge, and this was another episode of the Chiropractic Research Breakdown. Go slay some subluxations. I love you.